So you're facing the drawers, both feet on the black square.
You are? You and your
And
best
then bring
friend.
your left foot off to the side, so just the right foot's on the black part.
Yeah, actually, I was in a break my parents
Lift up this foot.
she told me it looked nice yesterday.
I'm going to cut off your bandages. I'm going to make a cut here. As I start to peel away all the layers, if you see any dried blood, that's all very normal. When we get closer down to your skin, you'll see your incisions on the insides of your feet. There's going to be some nude colored tape covering it, and there's no stitches that have to come out today or ever. They're internal and dissolvable, so you don't have to worry about that.
Okay.
If you see any bruising on your toes, that's all normal as well. You've got some bruising here too, which just means you did a good job elevating your feet this week.
Oh, great.
Okay? What do you think?
Looks good. Looks
Good.
Wow.
Everyone always says it's like looking at someone else's foot.
It is, yeah.
I always like taking off bandages for bunions because with some surgeries you can't physically see what was fixed. But with this one you can right away look to see what was corrected. It looks great.
It already looks really good.
Yeah, right now you don't have too much
like
swelling.
not. It is like not even looking at your own foot. It's so weird. Oh my god.
It looks awesome.
Good.
You happy?
Wow.
Looks great.
Wow, that's crazy.
It looks great. So what you can see on your feet is you've got the nude color tape. These are called steri strips, and these are holding the very superficial layers of your skin closed while the sutures are healing, or the incisions are healing. What'll happen is you can go ahead and take a normal shower. You can get your feet wet. The only thing we don't want you doing is submerging your foot in any water, so don't take any baths for right now. And just make sure your shower drains really well, so when you're showering, your feet aren't sitting in a whole bunch of water.
Okay.
Okay, you can wash your foot, just don't rub directly over your incisions. As you get your feet wet, what'll happen is the tape's going to start to peel away at the edges. And what you want to do is just take some scissors and trim away those free pieces so you don't have anything dangling. Okay?
Okay.
3 weeks from today, if you have any tape left on your skin, you can go ahead and peel all of that off. If tape falls off before that date, that's no problem. You don't have to worry about that. And none of the tape is going to be painful when you peel it off either. Okay? You have clearance to drive a car whenever you feel safe and ready.
Okay.
Right now, you don't have too much swelling because you really haven't done a whole lot of anything this week, and you've been in the compression bandages. As you start to be more active, you're going to expect more swelling, and that's just normal part of recovery. So a lot of what we'll have you do moving forward is going to be swelling management to help keep you comfortable. Okay? So first is you'll stay on your anti-inflammatories, and you'll take those every single day regardless of your pain for the next 6 weeks. We're going to get you in a compression stocking today, and that's going to, again, help to keep compression on the area to reduce your swelling. Okay? You're going to go back into your gym shoes. You're going to stay in your gym shoes all of the time. The only time your shoes are going to come off is when you're sleeping, doing your physical therapy exercises, which you'll learn today, and then, obviously, when you're taking a shower, you don't have to have your shoes on. There's going to be times throughout the day that as you start to be on your feet more, your shoes are going to feel tight and uncomfortable because your feet are starting to swell. Don't take your shoes off and don't loosen up the laces. That's going to be something that you're going to want to do. Just take that as a sign that you're doing too much, and you just want to sit down, elevate, let the shoe and gravity push away a lot of that swelling. And then when you're starting to feel better, then you can go ahead and get up and be a little bit more active. Okay? So now the big question now is how active can you be? Yeah. So the total number of weeks in surgery equals the total number of hours you can be on your feet in a day. So right now you're exactly 1 week post-op, so you can anticipate about an hour to an hour and a half on your feet total in a day. What your feet will tolerate at this point is about 10 to 15 minutes at a time before you're going to feel some, soreness, some swelling setting in. So then you just want to sit, rest, and elevate. And then when you're feeling better, you can get up again, totaling an hour to an hour and a half. On Thursday of next week, then you can add an hour because you'll be 2 weeks post-op.
Oh, after Thursday.
So Thursday's your surgery day, so every Thursday you'll add an hour. So you don't have to get a timer and time every single minute you're on your feet. It's just more of a general guideline so that you know when you go home today, you can't expect to spend 3-4 hours on your feet. Your feet will be very tired, you'll have a lot of pain, and you'll have a lot of swelling. At this point, the only exercise we want you to do is non-weight bearing exercise. So you can ride a stationary bike. We actually like yoga, so you can go back to yoga pretty quickly. The only thing in yoga we don't want you doing is anything where you come up on your tippy toes. But yoga really helps to promote strength and range of motion.
So I could do a whole like half hour
Yep.
or an hour
Yep,
of yoga?
yep.
Okay.
As long as you're non-weight bearing, you can exercise for as long as you want. So riding a stationary bike, anything where you're seated, so if you want to continue to lift weights, you can do that seated.
Okay.
Any floor work you wanted to do, core stretching,
Okay.
as long as you're not adding more weight to your feet. So no squats, lunges, Stairmaster, treadmill, elliptical, that kind of stuff until we see you again in 6 weeks.
Okay.
Okay? You want to see your x-rays?
Sure.
Okay.
Yeah.
This is your right foot, so this is you before surgery. So you can see you've got the bunion here, the first metatarsal is going that way, the toe is leaning that way, and then here you can see everything is sitting nice and straight. Same thing, this is before surgery, and then here's after surgery. Looks good.
Physical therapy will begin 1 week after surgery. It will last approximately 4 to 6 weeks. This is very important for flexibility and strengthening.
Stretches. Did you take any pain medication today?
Okay. Yeah, like 3 hours ago.
Okay. Are you feeling nauseous anymore?
No.
It's just weird when people start moving
Yeah,
around.
it's just weird because he just took the band-aids off, so it's just like...
Everything's all new
Yeah.
to you, for sure. So the exercises that I teach you are going to be pretty simple. They're not all that exciting, but they're really good to start working on the mobility of the toes there, okay? So you're pulling this up till you're in a neutral position, like that. Okay. Now go ahead and point your toe down. Good. I'm going to help you a little bit. Ready? Point. Good. And relax. Point. Good. And relax. Point. Perfect. Good. It gets easier as you go.